We're going to have to start grappling with end-of-life issues. We're going to have to start grappling with questions about what constitutes medical intervention. 10 years ago, 15 years ago, we weren't spending the billions of dollars we're spending today on cosmetic surgery, Botox, ED drugs, you know what I mean there in terms of ED. You know, today they've become therapeutic, medically accepted interventions, which in many cases are covered by your insurer. That's adding hundreds of millions of dollars to the shortfall. Guess how much money last year Vanderbilt delivered in uncompensated care for which we didn't get reimbursed by anybody?
100 million.
Take a guess. What? How much? 19 million?
100 million.
100 million. You're not even close. 240 million. That's up from 153 years ago.
Osborne is also concerned about the Medicare-Medicaid programs.
And the trust fund will only be bankrupt sooner. And so it's an unbelievable issue. There are very few, frankly, people on Capitol Hill with the courage, like Jim Cooper, who's going to be over here in a half hour, that will actually talk about this issue.
And Congressman Cooper did, in fact, talk about the issue with students.
Blue wedge, Medicare, Medicaid, that's what's eating up the entire U.S. government. Pretty soon, it will take all federal revenues just to fund those two programs. There won't be any money left for national defense or anything like that. Standard & Poor's has said by 2012, that's when the next president's going to get reelected, the Treasury bond would lose its AAA rating. If you think we've gone through a financial mess in the last month or two, hold on to your hats when that happens. Look at America. And we don't get value for our money. You know, we rank between 15th and 35th, depending on how you want to categorize it. So, ton of waste right here.
You know, other countries' main economy is below our healthcare market, and I think that's a pretty big deal. That's pretty astonishing.
This is the Healthy American Act. It covers 99% of the 45 million uninsured. Same benefits that Congressman gets. Restrains health spending, no new taxes. It redistributes the tax break. Now it does have an employer and individual mandate. This is very controversial, especially for Republicans. So it's a miracle that 8 Republicans have signed on.
Like many of our other speakers, Cooper advocated that bipartisanship is necessary.
This is what bipartisanship looks like. That's an ugly animal, but it works.
Following Congressman Cooper was Dr. Ezekiel Emanuel from the National Institutes of Health.
Jim Cooper is right. This is a phenomenal problem. The financing system is inefficient, inequitable, and fiscally unsustainable. But more important, in my opinion, is the second. The delivery system, how we get care to you, is completely fragmented. That means that true healthcare reform has to address both the financing and the delivery side of things. If it only does one but not the other, you know it's not true healthcare reform. It's unsustainable. The real problem in the presidential election and the debate that we've been having for the last 3 or 4 years about healthcare reform, it's almost exclusively focused on the financing system and trying to get us to universal coverage. That's a very laudable goal, but it's not sustainable unless we change the delivery system. All healthcare reform can be categorized into one of 4 flavors. The Guaranteed Healthcare Access Plan, that's my plan. It's very similar to what Jim Cooper talked about as the Ron Wyden and Robert Bennett bill. You'll see the similarities. You'll see there's some subtle differences. There's incrementalism. There's the individual or employer mandates, what they're doing in Massachusetts, and there's single payer.
Emanuel also took a few moments to go over his own bill proposal.
Health plans have the guarantee issue that is someone brings them the certificate, they have to insure them. There's no exclusion for pre-existing conditions. You as an American, not your employer, not the government, choose which health plan you go to. And Americans who don't enroll are randomly assigned. There is no fiscal barrier to getting coverage. Third, the whole thing is funded by a dedicated value-added tax. Starts at 10%, goes up to about 15%. Fourth, people have freedom to purchase more services than the standard benefit. We eliminate the tax exemption for employment-based coverage. We're getting rid of that, so employers are going to stop providing coverage. We're phase out Medicare, Medicaid, and S-CHIP and all government programs. What that means is we don't throw people off who are on it, but we don't renew that program.
Each panel discussion member had a few minutes to speak freely, then answered some questions posed by the moderator, Vanderbilt professor John English.
People are afraid of change. They want change. They want a better system. They want a true healthcare system, but they're afraid that even if what they have now is awful, they're afraid they're going to lose it.
iPod has changed the way that I listen to music. It changed the way I buy music. That's what needs to happen with the healthcare industry. It needs to change in the way that we go approach everything.
Imagine a business where no one really wants your product. No one really wants to pay for your product. Everyone expects your product to be perfect. Everyone second guesses your product. Everyone expects someone else to pay for your product. Everyone periodically is desperate and panicking for your product. Well, that business is healthcare. And those characteristics that I've just described are a reflection of why it is so complex and complicated to try to reform healthcare.
Our healthcare system today is unfair and it's unjust. In fact, the people who pay for healthcare in America today are people like us. We've got health insurance, so here we've got a population that's paying for the healthcare system that never used the system. The people who use healthcare aren't really the ones that are paying for most of it. Half of the Medicare dollars are spent on people who have less than 12 months to live. Quarter of the Medicare dollars are spent on people who have less than 60 days to live. In America, we're so involved in interventional medicine that we spend so much of our budget on people at the end of life. We don't spend much money on good prenatal care. We don't spend much money on immunizations. We don't even pay for AIDS drugs for moms who have HIV to keep their kids from getting it. Our healthcare system today is unfair.
What do you believe to be the best about the current system?
Innovation is what drives not only here but across the world. So for me, innovation would be it.
A lot of the science of medicine starts here in America, and so that's a very good thing with regard to research and with regard to innovation and technology. I guess in terms of the delivery system, what I personally believe is nice about our system is the fact that any one of us at any time, all of us, can obtain emergency service, emergency treatment in any hospital at any time of the day or night for the treatment of emergencies regardless of any ability to pay.
America is really the best place in the world to learn your craft if you're a healthcare provider.
Okay, next question. If the next president, and we don't know who that's going to be, what is the first thing I need to do about healthcare? What would you tell him?
What I would say is you need to figure out the best use of the money in the short term so that we can try to shore up some of the things in the healthcare system.
I would say this is the amount of money that we're going to spend on healthcare, and we're not going to spend a penny more. And I think that we need someone to force us to look at how much things cost and prioritize.
I think we've got to find a solution to Bruce's point, establish a budget, here it is, and then within that we've got to find a way to bring the 45 million Americans into the system. Without that, we'll continue to have this system that really isn't a system at all.
This video is by no means comprehensive. You are encouraged to seek more information under the Education tab on SHOUTAmerica's website.